Hello, friends. Welcome to Parkinson's EmPower Talks, a journey of empowerment and understanding for living your best life with Parkinson's. Kick back, relax, and get comfortable. We're here to make your Parkinson's journey just a little bit easier. I'm your host, Daisy Reimer. I'm a nurse practitioner specialized in movement disorders and the director of medical advising and education for the Wisconsin Parkinson Association. The Wisconsin Parkinson Association's mission is to provide hope, community, support, and resources for people with Parkinson's and their loved ones. Welcome to Parkinson's EmPower Talks. My name is Daisy Reimer, and I will be your host. And today we are talking about apathy. And my special guest is Bryanna Bruger, who is a doctor of psychology with Aurora Healthcare. Welcome, Bryanna.
Thank you so much for having me.
You're so welcome, and we're glad to have you on this topic. Before we dive into that, can you give us a little bit more background on you, like where you practice, as well as, how you became interested in Parkinson's?
Yeah, so I'm a clinical neuropsychologist, and I'm currently working at Aurora on the St. Luke's campus. And I'm a part of the DBS team here and work with other aspects of movement disorders as well, like functional neurological disorder and such. But I really became interested in Parkinson's when I was completing my postdoctoral fellowship at St. Louis University, SSM Health, and was on the DBS team there and really enjoyed those evaluations and being part of those patients' journeys and things. So that was really kind of where my Parkinson's disease interest was sparked.
Mm-hmm. Wow, that sounds really interesting.
Yeah.
What about, so our topic today is on apathy, overcoming apathy, and maybe strategies for increasing motivation. Can you tell us first, what is apathy? What's like the definition of apathy?
Yeah, that's a common question, especially when we're doing neuropsych evaluations and that pops up and people are like, oh, I never even knew what that was. But so apathy is a kind of a complex but very distinct neuropsychiatric syndrome. And it has a lot of underlying mechanisms in the brain that are kind of responsible for that. But they're really kind of a cluster. Apathy is like a cluster of behavioral symptoms that are characterized by decreased motivation, so not really wanting to get up and do things, decreased goal-directed behaviors like going to the market to buy flowers or taking medications to reduce symptoms, reduced interests or emotions in general, so not having as much emotion. And typically that is not caused by emotional distress or cognitive impairment. And within apathy, there's 4 domains or kind of subtypes that could potentially be affected. And so that kind of leads to a variable presentation of apathy. So it can look different in different people. I won't go into a lot of details about this, but the 4 different subtypes can be helpful for providers to know because it can change the medications or the treatments for the apathy. But there's reward deficiency syndrome is one subtype of apathy, and that's where there's these reduced levels of like dopamine, and which is responsible for pleasure and motivation, and that can cause kind of this emotional blunting or no emotion on the face. And so that person then kind of has difficulty experiencing pleasure from everyday activities, like socializing, hobbies, things like that. So that's one subtype. And then we have an executive dysfunction subtype, which I'll talk a little bit more about later. And then there's a depressive subtype, and then there's an autoactivation deficit subtype. That one has a lot to do with loss of kind of self-driven behavior and having this sensation that there's a mental emptiness almost. And that's, yeah, so those are kind of the 4 subtypes and can be very helpful, like I said, for people to know.
So helpful. People really just don't understand that this is even a part of Parkinson's, one of the non-motor features of Parkinson's. However, I can tell even just clinically with my own patients when they come in, and even when I do group talks, that there's a lot of frustration there by the patient as well as the family and the care partners and things.
yeah.
So I think this is such an important topic. So you mentioned, I know that one of these subgroups has to do with depression. As far as apathy, is it different than depression? And how the heck do you tell the difference between the two?
Yeah, yep, it is definitely different than depression. Um, Depression really involves kind of these feelings of sadness and emptiness and hopelessness that is not present typically with apathy. Um, and apathy can happen with depression.
Sure.
And when it does, it's often very disrupting actually to depression treatment. But it can occur without depression as well. And when both are present, they can really reinforce each other and make it really difficult for people to find that motivation and further deepen those feelings of hopelessness. Um, so in terms of, yeah, how would you tell? That is typically done via a really good clinical interview, and spending time with the patient. And there are some questionnaires out there that can be helpful to differentiate, and or like identify apathy, like the Stark-Stein apathy scale is a really common one. Um, but yeah, so some emotions and thoughts are more specific to depression. Um, so it can be really helpful to do that deep kind of clinical interview to figure out the presence or absence of depression emotions and symptoms to separate that from apathy.
And who does those? And who does those scales? Is that something that their neurologist would do, or is that something that gets referred to you in a neuropsychology referral?
Yeah, yeah, really good question. So those can be done, I would imagine, by neurologists, but I've never met one that's done them. But I think
Either.
that no, okay, okay, I was curious. But yeah, that's commonly done in neuropsychology, and some clinical psychologists who are providing like therapy treatment can also do that. But yeah, I would say most often in neuropsych evals.
So if somebody's suspecting that they either have apathy or, their loved one has apathy, it might be something that they'd want to ask for that, or, bring that up as we learn more about it today, even, and recognize those symptoms, they could ask for that referral.
Yeah, yeah, absolutely. And I think it's helpful to kind of know, as I know before I got into this field, neuropsych and psychology and all that was kind of
Mhm.
confusing to me. But bringing up apathy and talking about, um, talking about that with your doctor is different than going into like talk therapy, right? So you're not going to be going in for weekly kind of talk therapy to talk about these symptoms of apathy and what to do about it. It's more so trying to figure out from like a diagnostic standpoint, and our neuropsych evaluations are not therapy. Usually they're just like one visit, one or two, in which we do a deep clinical interview, and that's something that's very thorough. And then there's a whole battery of tests that can kind of help us with that.
Mhm. And are those all just on like apathy and mood, or are they have to do with cognition as well?
Definitely with cognition. Yeah. So we're looking at all the different domains of cognition, memory, language, executive functioning. But then there's also a big component of looking at mental health symptoms because there's so much overlap between the two.
Sure. And oftentimes, like depression and apathy can also look like a memory disorder.
Oh, for sure.
Yeah.
Yes.
So if they get this baseline, get a baseline neurocognitive to in-depth neurocognitive testing, then is that something they do again in the future, or is that determined by you?
Yeah, that's kind of determined on a case by case basis. Sometimes we will recommend coming back in a few years. I will say that in some cases, there's a lot of like secondary factors, like depression, for example, that might be causing some memory problems or other cognitive problems. And so a recommendation might be go see this specific therapist for this specific treatment, and then come back in a year or two. And then hopefully there may be some improvement in memory. But if there's not, then we kind of have a clearer picture of what's going on.
So, when we're talking about apathy, is there a biological mechanism in Parkinson's that makes people apathetic?
Yeah, yeah, for sure. So that's why with the four subdomains, it can be helpful to know. And it's complicated to figure that out, but those four subdomains of apathy have somewhat different underpinnings in terms of the biological mechanisms. And overall, it's thought to be caused by dysfunction in different neural circuits and structures that potentially respond then to different treatment strategies. So overall, you can kind of think of it as damage to pathways that carry dopamine and a couple other neurotransmitters.
I think it's so important for people to understand that it can be biological,
For
that
sure.
it's just a choice. I think
Yeah.
that's what people struggle with is, whether the person really wants to be active and exercise and things like making some of those lifestyle changes versus not trying anymore. I think.
Yeah. And I hear a lot of
Mhm.
like people accusing their loved ones or something like along those lines of them being lazy, right?
Right,
But we know that that's not actually what's going on. It's
right.
some biological changes in the brain.
And you mentioned before, some about how it can affect taking medications. So apathy can get in the way of taking medications as well as, your daily functions.
Yeah, absolutely. So apathy gets in the way of goal-directed behavior. So you can kind of think of that as like, we do this automatically all the time, but if we, let's say I want some flowers and I got to figure out how to get the flowers. So then I have to kind of plan in my mind that I'm going to go get in my car and I'm going to drive to this market and step by step process.
Mm.
That's goal directed behavior. And it's the same thing with taking medication because you have to figure out, do I have enough to last me until this time? How do I get a refill? When and where and how do I get the medication? That's very much goal directed behavior, as most activities of daily living are. So it is very important to diagnose and treat apathy as best we can, or at least get some help with it.
All that executive function, the sequence.
Yes.
Mhm. Yeah.
Hmm.
So we know that exercise is crucial to help slow the progression with Parkinson's. How do you exercise when you're apathetic, when you don't have that motivation?
Yeah, it's really hard.
Mm.
It is hard. I think acknowledging, first of all, that it's hard and validating that this is not easy.
Right.
Um, but it can be done. And it's important to consider, activities that the person enjoyed in the past
Mhm.
and then start small. Establish a consistent routine and schedule in terms of activities. Um, it can be helpful to find like an exercise buddy to go with. That way you kind of don't have a choice because they're holding you accountable.
Right.
Um, Sometimes people will talk about finding success with like personal trainers or things of that nature to kind of have external cues for that motivation piece. Um, there are, I'm not as familiar in this area, but I know that some communities have like local Parkinson's disease organizations in which there are specific exercise classes and groups that are for individuals with Parkinson's. And so, kind of being around other people who are experiencing somewhat of the same things can be really
Right.
helpful.
Yeah, we have those listed on our website. So that's
Oh,
something
good.
on our wiparkinson.org website. And I agree with that. I know a lot of times, even in my own clinical practice, if somebody was having a hard time taking that initial step, I would say, well, maybe first going to physical therapy and doing like the Big or the Loud program
Mhm,
that's
mhm.
specialized in Parkinson's to get your confidence up before getting into a community program, because sometimes just hopping into those community programs can seem kind of scary and
Sure.
overwhelming. And then I always tell them I get notes back from the therapist, so I'm kind of keeping track of you. So there's a little accountability from the provider standpoint,
Yeah.
and then linking them into the community and just saying, don't go once, make sure you go a few times
Yep.
to get your comfort level up with it. But people struggle with it. I had one fella in particular that he was always very athletic, and he would come in, he's like, I want to exercise, I just cannot get myself to do it. And he literally would come in every time like, I need you to help push me. I need you to tell me where I need to go and what I need to do. And
Yeah.
that's hard as a provider too, if somebody really is wanting to and try to get them, but they can fall off the wagon just as soon as they walk out the door.
Yeah.
So,
Yeah. I think
being
it's really helpful then when we have like that exercise buddy or that
right.
person who's going to hold them accountable outside of their medical providers, because that is it, right? Like that's you could get them going for a couple times, but then it's
Right.
they may fall off the wagon, like you said.
And
Yeah.
even having do it even with a spouse, to where you're going together so it doesn't feel like the spouse is
Yeah.
maybe nagging at you to do it.
Yep.
Rather, it is something that you do together and that you can enjoy together.
Yeah.
Mhm.
And I think the type of exercise too makes a big difference. Because there are certain types of exercises that are, maybe more easier on patients with Parkinson's, like low impact stuff and yoga and Tai Chi and sometimes, but good old walking and
Yeah.
bicycling can do the trick too.
I always say that the best exercise is the one that you'll do.
Yeah,
Because
exactly.
if you don't like swimming and you don't want to get in your swimsuit, you're not going to do it. You're not going to
So
complete
true.
it.
Yes.
So what do you when you see people and you're talking about some of these strategies, what are some strategies to increase motivation and engagement, like from a neuropsychological standpoint?
Yeah, yeah. Um, so you'll probably hear me say a few more times before the podcast is up, but I'm big proponent of routine and schedule, and especially for individuals with apathy, um, it can be really helpful to have somebody be providing external prompts and commands. So um, things uh, like instead of a verbal cue for let's go, or do you want to take a shower, and asking that question, instead of that saying more of like a direct cue of it's time for us to shower, or it's time for you to shower, or something along those lines. um,
Instead of making it optional, is what you're
yeah,
saying. Mhm.
exactly,
Okay.
exactly,
Mhm.
kind of providing more of a direct prompt.
Mhm.
um, and within that kind of routine and schedule, making sure that it's gentle enough that we're not being like super strict and rigid, but also like knowing when to expect things can be really helpful. um, Getting outside as much as possible, so that, I mean, there's been countless studies that show that improves general mood and sleep, which are both very much linked to motivation. And so if apathy is the motivation problem, then yeah, that could just be eating lunch outside or just sitting outside, whatever it is. But yep, and then some lifestyle modifications in terms of strategies to increase motivation and engagement. Um, so the exercise, like we talked about, making sure they're getting adequate sleep, and then engaging in some sort of relaxation exercises, like diaphragmatic breathing or yoga or Tai Chi, like we mentioned before. Those can be really helpful to increase motivation and engagement. Um, yeah, and then kind of going back to the routine and the schedule again, scheduling pleasant activities or things that's going to allow the patient to feel, or the person to feel, like they're mastering something and they're achieving things, even if it's small, like making the bed. So things like that.
So if you're taking walks, making it a place that you actually enjoy, that feels pleasant, and that'll draw you out a little bit more, right?
Yeah.
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 What about, do you notice in your practice and things, do you notice like a time of day with apathy? Do you notice that it relates at all to like their dosing of medication, or that it's stronger in the morning versus stronger in the evening? Or is it just an overall steady feeling that they have, or steady flow, I guess?
Yeah. I'm not too sure on that. I would
Okay.
imagine it, well, yeah, I'm not sure.
Mhm.
I know that medication treatment in terms of helping out with apathy can be, it's pretty early in the research processes thus far. Um, there have been some studies that show that there's some medications that can help improve apathy. I'm not sure about the different times of day though.
Okay.
Yeah.
I was just thinking in terms of you were talking about setting up routine. I'm thinking, well, if people are having a hard time moving in the morning, it's probably even harder for them to feel like motivated to
Yeah.
get up and move in the morning then too. So maybe setting up your nighttime to be more to achieve those goals better in the morning, like know what you're going to wear and keep it simple
Yeah.
and things like
Yeah.
that. When we were talking about routine, I just thought sometimes we don't prepare our nights to have an easier morning if mornings are difficult. And I wasn't sure if you
Yeah.
saw that clinically too with relationships.
Yeah. No, I'm not sure on that one.
Mm-hmm.
It would make sense though.
Mm-hmm. And then what about, we mentioned before about executive function, and we know that that's part of the frontal lobe issue with Parkinson's. And so is that affected with Parkinson's, and how does that play into apathy?
Yes. So executive functioning is
Mm-hmm.
definitely affected by Parkinson's in a couple different areas. So, I mean, like a couple different areas of executive functioning, because executive functioning, there's a ton of things that our frontal lobes are responsible for. But some of the main kind of heavy hitters that we see are difficulties in areas of planning. So, like we mentioned, like kind of those multi-step plans to do the goal-oriented behavior or goal-directed behavior. Making decisions can be really challenging. Task initiation, so starting the tasks. Coming up with words quickly is something that we can see as being problematic in Parkinson's. And then difficulty with some people have difficulty with recognizing emotions in other people. Apathy has also been related to individuals who have more severe motor impairment, worse executive dysfunction, and have a higher risk of developing dementia than Parkinson's disease without apathy. So that's kind of some other things that we know about apathy.
Very
Yeah.
interesting. And then as far as the spouse and the family and the friends go, how does apathy affect them? I think of, again, in kind of my own clinical practice, like you have a spouse that comes in and goes, why won't he do this? Why I want him to be better. I mean, it's good-hearted. That there's good intentions there. And it's really hard when we're trying to motivate our loved one to be who they always have been. Maybe they've always exercised and now they're struggling, and we want them to be the best version of themselves. And you can't make somebody do something, even if it's the right thing and it would be good for them. And that can be really frustrating for caregivers. I can't tell you how many accounts I've heard of this where they're just frustrated, and that comes out in some of their interactions, even in the home, because they want them to be better, and they know that exercise can help that, but the person just isn't motivated to do it. So what advice do you have for those loved ones that are feeling that?
Yeah, it is tough. I think acknowledging first and foremost that apathy is a huge contributor to caregiver emotional distress.
Mm-hmm.
I don't think you're the only one noticing that. Apathy, you know, especially, we want to talk about too, like, especially if it's not diagnosed or well understood, can definitely cause frustration and distress for loved ones. And for the reasons that you said, that they might then interpret that person's disinterest for like, well, they don't love me anymore, or they're lazy or stubborn or depressed. But
Giving
so
up. Sometimes
yeah,
they think of it as just
exactly.
plain giving up.
Yep.
Mm-hmm.
Yep. And so educating yourself, which I would imagine that the listeners are doing, since they're here. But apathy, yeah, it has a huge effect, and it can lead to decreased engagement in social activities. So then that leads to difficulty maintaining friendships and relationships and further isolation, which we know is not good. And increasing the burden on the caregiver as they're kind of needing to take on more responsibilities and provide more support for sure. So we know it has a huge effect on spouses and loved ones and things like that. So in terms of things to do for that, again, consistent routine and scheduling. Um, it can be helpful to, in order to kind of get your loved one to do some things that they need to do, is to kind of bring in other sensory cues as well. So if you are trying to encourage them to take their shower, um, you know, coming up with some sort of aromatherapy. So getting some lavender stuff in the shower room or whatever scent they like. Feeling the water before they get in, playing soft, calming music in the bathroom. Things like that can kind of make it more appealing to different senses.
Sure. Yeah, that's a very good point. And, it's hard, I think, because sometimes you almost have to try it on yourself or put yourself in their position and go, to better understand it, try to project yourself and how you would feel with that too. I think that can help them maybe have a better understanding or try to have a better understanding of what that person is going through.
Yeah, yeah.
We've talked
And
about
I
that a
think,
little bit in our caregiver support group, our virtual caregiver support group, is just to kind of put yourself in their place a little bit and go, all right, now I'm not the care partner. I'm the person who is struggling with this. How would I really feel? And knowing that your reaction might be different than their reaction. And
yeah, yeah, definitely. And I think that can be hard to do on your own.
Mhm.
And with having the caregiver support group, that's excellent. There's also getting your own emotional support, reaching out to a therapist to kind of help process and um, kind of examine some of the thoughts that they're having, because a lot of caregivers, especially with patients with Parkinson's that have apathy, describe feeling angry, or they're having thoughts that they're like a failure because they're not doing enough to help the patient. So kind of processing and challenging that with the assistance of a therapist can really help reduce caregiver distress too.
Right. And I think too that sometimes that the caregiver ends up feeling like they're nagging, how they feel like they're nagging. And sometimes even if you have children step into certain situations and try to encourage them in a different way so that it's not you making all of those requests all
Mm-hmm.
the time on it. And it's a different voice. Or sometimes they'd contact me before a visit and say, we're really struggling with this piece and I feel like I'm nagging. Can you please bring it up and let them open up to you about it? And so it became my role as a provider to take that on and maybe give advice, because they see that advice coming from somebody different than the spouse all the time.
Yeah,
Yeah.
yeah, yeah. And then, there's external cues too. So if there is like kind of that sensation of I'm nagging them and they're probably sick of me and I don't want to be nagging, try doing external cues. So, if you need them to sweep, I don't know, something like that,
Mhm.
put a broom in their hand. Or if you are trying to do dishes with them, do it alongside them. So you start doing the dishes with them.
Right.
And then once they kind of get going, then step away from that. But those external cues can be helpful.
And that might be hard to take that time to do it, because a lot of times they're wanting to say, here, this is your piece while I go off and do my
Uh-huh.
piece. So it
Yeah.
might take a little bit more coaching in order to
Mm-hmm.
kind of get there. But you're saying eventually, hopefully, they catch on to that and it becomes something that's more helpful. So sometimes
Yeah.
slowing down can
Yeah,
be really hard to do too.
for sure.
So does apathy look different? I always like to include caregivers and then also our young onset cohort of people. What about the individuals with young onset Parkinson's? How is that different for that group?
Yeah. So I think that the young onset people with Parkinson's disease are more likely to experience depression and anxiety. I think research has shown us that. And it is so someone who has young onset PD and depression, they're actually at risk for getting apathy then. Um, so, and there's some evidence that shows that it's due to some damage in the pathways responsible for serotonin. Um, but that apathy and if there's the combination of depression can be really impactful
Yeah.
for people who are younger and are fully in the workforce and are having families, and they have all these obligations and responsibilities that they need to do. That can be super distressing. For sure.
Especially if they're breadwinners and it's financial.
Yep.
And they're just not as motivated as they were with work or family. Yeah, I can see
Yeah.
it having a huge impact. Is that then because they, you mentioned the serotonin pathways? Is that then because they have it longer, or is that something that apathy even shows up kind of early on? Is there a
Yeah.
timeline on that, or is that not necessarily the case?
So my understanding is that if you have depression and in young onset, that you're at risk for developing apathy. So then
Okay.
I think it would come later.
Later. Okay.
Don't quote me on that though.
Okay. Yep. I keep hearing your comments and just trying to gain more information from you. So
Yeah.
and then what advice would you give as far as like studies? What kind of research has been out there as far as apathy?
Yeah, there's been a couple studies out of Europe. So a 2025 study out of France on improving apathy in early Parkinson's disease. And like I mentioned, there's been a few studies in the last 5-10 years looking at medications for apathy and trying to find efficacy for that. There was another one just recently out of Ireland called Treatment of Apathy in Parkinson's Disease and Implications for Underlying Pathophysiology. I think that gave us a lot more information about those kind of 4 subtypes and stuff like that. So I can send those to you and can send them out or link them.
Very good. Thank you. I appreciate that. I always like to keep with research.
Oh, for sure.
What about, so if people are, whether they're a person with Parkinson's or families need more help, what would be their first step? How do they find out what do they do as far as bringing it up with their provider and such?
Yeah, so I think first thing would be to bring it up with your provider, and then looking at local organizations like the WPA. And then of course, I'm biased, but I encourage everybody to get a neuropsych evaluation, because we can identify the patient's strengths and weaknesses, even if they're not perceiving to have any. That can still be a good baseline for a disease that we know can potentially move into dementia. So in identifying those strengths and weaknesses, then you are able to, as a caregiver or even as the individual, focus on the strengths and not the weaknesses. So that can be really helpful. In terms of other things, yeah, I think just getting as much information as you can. Knowledge is king. So just trying to get as much information as you can through the resources that you have.
I agree with the baseline neurocognitive testing, and I obviously ran a memory clinic too. So just gaining more information and insight, I think that also helps the family members and the caregiver and the person to just kind of know what piece of the pie is this. Is it depression? Is it apathy? Is it a memory disorder? And a prognosis on that, right? So that you have some idea, and then also where you might end up going for treatment, how you can really bark up the wrong tree for a long time with antidepressant medications and things like that when it's not depression, if maybe it's more memory or it is apathy. So I think that it can save you a lot of time and heartache and extra medications if you just get that baseline neurocognitive testing to really help steer the ship. So I absolutely agree with that, Bryanna.
Yeah, and to your point about the antidepressants too. So as a neuropsychologist, medications are definitely not my wheelhouse, but in looking at some of the research, if you don't have depression, but you have apathy, antidepressants can make it worse, I think. Right. And there are other medications that can potentially be helpful. Again, the research is pretty fresh on that still, but getting that thorough evaluation to figure out if apathy is present or if there's also depression with that, again, really can guide treatment and change some aspects of life.
Sure. And not waste too much time doing it.
Yeah.
And you would definitely stew and be doing, like I said, barking up the wrong tree with treatment. So
for sure. Yeah.
If you were to give our listeners one piece of empowering advice, what would it be?
I would say just to know that there is hope and to keep putting one foot in front of the other, no matter how hard it may seem, especially in the context of apathy. But yeah, that there is hope and that there are people out here willing to, help and share information and get you on the right track.
Super. I thank you so much for joining me today. I really appreciate your insights, and I hope that all of our listeners appreciate all of your explanation about apathy. And if it is something that they're dealing with, they talk to their providers, perhaps about getting that baseline neurocognitive testing.
Yeah, absolutely. And thank you again for letting me do this.
Absolutely. Well, you take care now.
Okay, you too.
Bye-bye. The Wisconsin Parkinson Association is a grassroots organization funded by people like you. To support more local programming like this, visit wiparkinson.org.